Hello there everyone, and welcome to this video that is streaming on the Just for Tummies Facebook page, the Tummy Talk Facebook community page or group, on the Just for Tummies YouTube channel, and on LinkedIn. So welcome to all of you who are watching live on any of those different platforms. If you are watching this on catch up at a later date, then thank you for watching. And if you have any questions, you can ask your questions below this video. We will get a notification and we'll get back to you. Or you're welcome to email us, and I'll go through the emails later. But just to introduce myself, I'm Linda. I'm Linda Booth. I've been a natural health practitioner for over 30 years now, and I specialise in digestive and gut disorders. I'm also the founder of Just for Tummies, the UK's only dedicated range of supplements to help the millions of people who suffer with common digestive and gut symptoms. So the only range that's been developed by a practicing natural health therapist. Jane Bush, a colon hydrotherapist, is going to be joining me this evening. Well, I hope she is. I've sent her the link to this video and I'm just waiting for her to join us. But there's still plenty that I want to get through before Jane does join us. Now, I've called this video "The Power of Colon Hydrotherapy." I'm an ex-colon hydrotherapist. I closed my clinic, I think it was just over 3 years ago now, because I just got too busy running Just for Tummies. But I passionately believe in the benefits and safety of modern colon hydrotherapy. And the reason I wanted to make this video was because next month, April, it's IBS Awareness Month, and it's also Bowel Cancer Awareness Month. And when it comes to IBS, and I'm speaking from experience here, when it comes to IBS, there is no better, safer, and more effective treatment than colon hydrotherapy, especially if your IBS symptoms include bloating, uncomfortable bloating, painful trapped gas, and constipation, in particular chronic constipation, where you've tried everything else and nothing else has worked for you. So yes, so I've had people email me and ask if they can't watch the video live, can they watch it at a later date? Well, yes, it will be available on all of the aforementioned channels. So Just for Tummies Facebook, Tummy Talk group, YouTube and LinkedIn. But we will also be sending it out to you, or to those of you who have subscribed to receive our newsletters. We'll be sending it out in a newsletter too. And it will also be available on the Just for Tummies website. If you go to the blog section, you scroll down under health videos, we will post it there as well. So, as I said, you're welcome to post any question below this video if you're watching it live, and we'll try and answer. It just depends how many questions we get during the live, because we've got quite a bit to get through. If we don't answer your question tonight, then we will answer it over the next day or two. You're also welcome to drop us an email at feelgood@justfortummies.co.uk. And I'm just going to check, we're getting a few comments already. Yes, it's just people who are watching. That's great. So no questions at the moment. So what I'd like to do is debunk a few myths about modern colon hydrotherapy. So colon hydrotherapy, or colonic irrigation, has been around for thousands of years. Ancient Yes, so it was practiced by ancient Egyptians and many other ancient civilizations, and ancient philosophers such as Hippocrates and Galen advocated the use of colonic irrigations to purge the bowels and to help heal numerous diseases. and I'm sure you've all heard of Kellogg's cornflakes. Well, Dr. Kellogg of the famous cereal company was a huge fan of colon hydrotherapy, and everyone who attended his sanatorium in Battle Creek, Michigan, America, was encouraged to have the treatment. Hospitals and GP practices had, up until after the Second World War, some kind of colonic equipment installed. But when medicine became more mechanized and drug-led, it fell out of favor. So what is a colonic? Well, first of all, it's a way of removing impacted wastes and trapped painful gases from the large intestine. And this is the equipment that we use. This is a single use colon hydrotherapy kit with the tubing and the speculum. So what happens? We have two lots of tubing here, and I'll just demonstrate it. So this thin, lots of tubing. So this thin piece of tubing, okay, is attached to a speculum. Now people get really nervous around the speculum, but really there's nothing to it. If you see the size of it, I'm just going to invite Jane if she's here. Just bear with me a moment. Hi, Jane.
Hello. I'm sorry about that.
No, don't worry about it. It's great to see you, Jane. I was just going to explain the tubing and the speculum, but we can come to that later. So what I'd like you to do, Jane, are you okay, by the way? Have you been in clinic all day?
Yes, I have. I'm fine. Yeah.
I thought so. So Jane, I've just kind of introduced myself and mentioned that you're a colon hydrotherapist, and I'd like, if you can, tell us what you do, why you do it, and why you love doing it.
Well, I'm an ARCH-registered naturopathic colon hydrotherapist. I've been doing this for 9 years now. And Linda really got me into it, having treatment. She was my original therapist that set me off on this road, really. The reason I do it is my family have got a lot of gut related problems. Me myself went to Linda because I've suffered from a child with constipation, and can remember my mum chasing me around the room with suppositories and sitting me on the tap toilet for hours. And it got to this stage when I got to a certain age and I was bloating and couldn't go to the toilet. And I'd always thought about colon hydrotherapy, but at the stage when I was looking at it, it wasn't that well known about it, really. And then I looked into it, and one of my ladies, I was a remedial therapist, massage therapist before doing colonics, and she had gone to see Linda, and that's how I got in touch with Linda and set me off on my road. But my family, in particular my mother-in-law, she ended up with a stoma, and it's something that Linda helped me with that, because my mother-in-law had a really built up bowel. It was mishandled by her GP. She was fed constant laxatives, and in the end she was what we call fecal vomiting. So she was bringing up stool.
Vomiting stool, yes, because her bowel was so blocked, nothing could get through.
That's right. So if it hadn't have been for Linda on the day, which was a Sunday morning, which you don't usually expect people to pick the phone up, but God bless her, she did, and just said, Jane, don't wait for an ambulance, take her straight down to A&E. And it ended up that she'd got a bowel blockage and ended up with some of her bowel being taken away. and having to have a stoma fitted. They said if we'd have left her another 4 hours, she'd have been dead that day.
Yeah, so that is a life-threatening situation. Yes,
it was. And like we were saying at the time, Linda, if she'd have managed a bowel, if she'd have looked after it and had regular colonics, it wouldn't have happened.
But not everyone knows, do they, Jane? They don't know the importance of bowel hygiene and, you know, bowel management or the management of constipation anyway.
Yes, they don't. And then also my husband, I lost him to bowel cancer, unfortunately. And like a lot of people, especially the men, didn't want the colonic done because of where the tube went, and you know, and just feeling embarrassed about it all. Overlooked a lot of the symptoms of bowel cancer, and ended up in stage 4 bowel cancer, and there's nothing that they could do for him. So I'm very passionate about bowel health. People jumping onto it, if they see anything whatsoever, jump onto it, get onto your GP, come and see somebody like ourselves to see.
Well, yes, any change in bowel habit needs to be checked out by a GP, doesn't it, Jane?
Yeah.
You know, certainly I'm just thinking about the red flags. Yeah, any change in bowel habit for 3 weeks or more, certainly blood in the stool, unexplained weight loss, unexplained tiredness as well. Just any change. And if you just feel as though, you know, I say to people, you know, listen to your body. If something doesn't feel right, act on that, and go and see the GP.
Don't let them fob you off, because my husband got fobbed off. You know, yes, he got told to go away and put his feet up and put bandages on his legs, and because he got edema because it spread into his liver.
But did he have any of the red flags, Jane? Did he have blood in his stool?
He did, but at the time he didn't tell anybody, and he thought it was hemorrhoids.
Right.
So if there's anything like that, you know, it's worth checking out. It might just be hemorrhoids, but it might not. You need to get it checked out. It's just so important. And if you feel, like Linda says, if you feel there's something wrong, push it. Don't let them leave it. Don't let you be pushed aside.
I suppose with Ada, your husband, with his mum, you know, your mother-in-law, she had bowel issues with constipation as well, and they can sometimes run in families.
Oh, definitely.
They?
Yeah, they do down my mum's side of the family. You know, we were all constipated and hemorrhoids and everything. So you do find it runs down in generations.
Yeah, so well, it's how I became interested in colon hydrotherapy, because, you know, I have a history of constipation as a child, and I remember my mum giving me that awful laxative chocolate as a child.
Oh yes, laxative. What was it? X-Lax, wasn't it?
I can't remember the name of it, but it was horrible. So I think I inherited my dad's lazy bowel. My mum, she doesn't have any problems at all. So yes, I come to you about 3 times a year, don't I, Jane? Although I no longer suffer with constipation. I don't have any bowel problems whatsoever. But for me, it's preventative. You know, I like to go, I like to check things, have a good feel around my abdomen as well. And it just makes me feel better.
It does, you know, and that's a good thing. Even if you don't have any particular bowel problems, just twice a year for a bit of a MOT, a preventative measure.
Really, and it's great for bloating, isn't it?
Oh, it's brilliant for bloating. Yeah, definitely.
Yeah, so if I say, you know, if although as colon hydrotherapists we don't really promote it as a beauty treatment, well, you know, if you're getting married or you're going to a party or you're going on holiday, you know, and you've got a bit of a bloated tummy, there's nothing better than having a colonic to flatten it down.
Yeah, definitely.
Right, so I just want to say, everyone, that this is Jane, and she owns Gedling Colonics in Nottingham. And if you want to contact Jane, that's her website there. But if you just Google Gedling Colonics Nottingham, you will find Jane. So we've got quite a bit to get through, and I've had lots of questions today from people, Jane, you know, who are asking all kinds of things about colon hydrotherapy. So we'll come to those later, but let's debunk a few myths and misunderstandings around colon hydrotherapy. So I've covered the history, Jane. You know, it goes back tens of thousands of years. The Egyptians used to practice colonic irrigations, didn't they?
Yes, they did. And it's the oldest recorded medical treatment and it was classed as a folk medicine from all around the world, really. So enemas and colonics, or is one of the longest known medical treatments. So, you know, implements found from 4,000 years ago, 1500 BC. From South Americas, we've got abstracts showing blow enemas. So it shows it's not a newfound thing going on there. It has been in our background for thousands of years. So it's nothing to be
to
afraid.
me, Jane, it's kind of common sense, really. You know, something goes in there and it's got to come out the other end, hasn't it? And if it's not coming out the other end, there's something wrong. If it's not coming out the other end, you know, frequently, there's something wrong, really. So, as I said,
and they used to call it toxemia, you know.
Yes, that's right. So just going, so I mentioned about ancient philosophers like Hippocrates and Galen. They advocated the use of colonic irrigation, and Dr. Kellogg of the Battle Creek Sanatorium in Michigan, and hospitals and GPs, you know, up until the 1940s, 50s, would have some kind of colon hydrotherapy equipment to help the patients, until medicine became more mechanized and drug-led. It fell out of favor. That was up until about the early 1980s, when Dr. Milo Seward in London, he came over from America and he began training nurses in modern colon hydrotherapy using the Woods gravity system.
That's right. Yes, that's right. Yes,
I think colon hydrotherapists have taken a bit of a battering though with COVID, haven't they, Jane? I think a few of them have kind of retired or just gone out of practice.
Yes, I think so. I mean, we've lost some good colonic hydrotherapists over the COVID kind of period, but you know, we're still going strong. We were, the arch therapists anyway, were allowed to carry on practicing 3.5 months into COVID. We were put under the other health services, so we were allowed to see emergency and essential clients, which was really good.
Yeah, it's a shame that, you know, that colon hydrotherapists couldn't make it through COVID, because they were in short supply anyway, Jane. You know, there's not very many. There weren't very many colon hydrotherapists prior to the pandemic, and there's even fewer now, which is not good, really. So explain a colonic, demonstrating the single-use colonic pack of tubing and specular. So if you, I've got one here. Have you got one there?
I've got one.
Yes. Okay.
So we use a clean, sterile pack for every client. Everything is single use. We follow the NHS guidelines very closely. So what we do first of all is do a full consultation with the client, make sure that they are fit for treatment. There are, as Linda was saying earlier, red flags that we have to look for when we're doing the consultation to make sure that you are fit for treatment and it's going to be safe for you. Once we've gone through that, we will get you on the table, and on first treatments we do a quick, what's called a digital rectal examination, and that's just really to check that everything's fine in there. There's no big hemorrhoids or anything what we call a fissure or a fistula, and make sure that when we pop the speculum in, it gives us more information. We're going the right way.
It's good as well, isn't it, doing the digital, because you can check the angle of the rectum, so it just makes insertion of the speculum a little bit more comfortable for your client.
Exactly, definitely. So we always do that on the first treatment. We have a little palpate or feel of your tummy, and we also do a little bit of tapping, so we can hear if there's any gas pockets in there, any fullness in any certain area of the bowel. And again, it gives us more information to work on. Being a naturopathic,
somebody's just sorry, Jane. Somebody's
like
just
Linda,
posted.
We love the herbs. We like to put a few herbs around.
Sorry, Jane. Can I just interrupt a second? Somebody's just posted this question. It's come
Yes.
up as Facebook user, so I think they've posted it in Tummy Talk. Yeah, and she said there's no
All
need
right.
to feel embarrassed. The treatment is done with dignity and everything is explained. And she sees your colleague, Sarah, this particular lady, gentleman, not sure who it is, which is great, isn't
lovely.
it?
Yeah, there's
Sorry,
no
Jane.
need to be embarrassed. No, that's fine. And then what we do is we pop the speculum in, which really is just a plastic tube, and it just enables us to keep the anal area open so we can feed water in and get any waste out. So it only goes up 1.5 inches, 2 inches, and the little disc, what you can see on the one that Linda's modelling, is just stops us over inserting it. And it's not painful. We use a really good lubricant and it goes in very, very smoothly. Once it's in, you forget all about it. And
let's be fair, Jane. Let's be fair. You know, when you look at that, the speculum, you know, what people evacuate from the bowel is a lot bigger, longer and wider than that, isn't it?
Yeah.
And you know, when you insert the speculum, it's got that rounded end, isn't it? And like you say, you put plenty of lubricant on as well. So it's pretty painless, really.
Oh, it is. I mean, I always say to people, I'm the biggest coward going, and if I dare have it, anybody dare. You know, I say if it hurt, I wouldn't have it. But yeah,
I remember my first colonic. I was very nervous. Yes,
I was as well. I was definitely. I think most people are, you know. But
it's natural.
If you've got a good therapist, if you've got a good therapist, they'll calm you down, and you'll be fine. It's not a problem. So once the speculum's in, we take the obstetrator out, which is the bit that makes the end nice and round, and we pop the waste tube on the end. That's right. So that comes out, pop the waste tube on, and you've got the water tube which goes on the little outlet bit at the side. So it's a sealed unit, really. The water gets fed into the bowel at a very low pressure rate, so it's between 1 to 2 bars, so it's less than the actual pressure that's in the bowel anyway, so you won't feel jet washed out or anything like that. It's quite nice and gentle and comfortable.
The water goes through this smaller tube, doesn't it? The clean, you know, filtered water, and then the waste water, and any solid waste and gases come out of this tube. And it's a closed system, so there's no odor, there's no mess.
No, it's very hygienic. Any waste goes straight down the main drain, so there's no smell there. And I think that's what people worry about as well, if there's any mess or smell or anything. But it's very hygienic. And we do a little bit of massage during the treatment just to help things along, get any trapped gases or waste out. And it's very comforting. I think if somebody's really bloated and full, the nice warm water just relax.
You know, if somebody's having a really bad IBS flare-up, Jane, where they're very bloated, very uncomfortable, and where they're constipated as well, there is nothing like colon hydrotherapy for giving a quick result and giving them pretty quick relief as well in one treatment. In one treatment.
Definitely. And like we see with a lot of clients, the gas, the bloating can be a majority of the problem. Once we've got the gas out, the waste starts to move. So it's a bit like a wall.
Well, yes, exactly. So you know when so what's actually happening inside the bowel then? So as you introduce the warm filtered water, and I'm thinking more about someone that's got IBS, that they get painful bloating and they get constipated, or they get alternating bowel movements. They can be constipated, or you know, they can have loose bowel movements. So it's the water, it's the warm water when it's introduced into the bowel very gently that helps release the spasm. It relaxes the bowel, doesn't it?
It is. Yeah, and we do a lot with water temperature. With IBS
Yeah.
clients, of course, we keep the majority warm, because it's like you're saying, there's a lot of spasming going on usually with IBS clients. So by keeping it nice and warm, it relaxes the bowel, releases any spasms, and just lets everything out. It works really, really well for them. You know, we get a lot of relief for them.
Well, I put here a colonic treatment. It's a bit like taking your bowel to a gym, isn't it, for a workout? You know, with the water gently stimulating the contractions of the bowel. Contraction, relaxation, contraction, relaxation. The medical term is peristalsis, encouraging the wastes and the trapped painful gases to release and go down the tubing. And you can actually, when you're treating someone that's bloated, Jane, you know, you put your hand on the abdomen, on the tummy, and you can actually feel the bloating go down, can't you?
Yes, it is just like a balloon deflating. So it works really, really well.
I'm assuming that when someone comes to see you, certainly when they come for the first time, Jane, you and Sarah take great pains to explain the procedure, show them the equipment, and also explain that, you know, they only need to take kind of the bottom things off. They don't need to strip entirely.
Oh yeah, we can be very, very exact things what to do, you know, and what to take off, what to leave on. We do always run through the equipment with you, ask you if you've got any questions, that kind of thing. We never rush people. That's one thing that we never do.
No. Right, so I know you alluded to it earlier, Jane. Some colon hydrotherapists use the prefix naturopathic in front of their colon hydrotherapist title. So I just want to explain to people what that means exactly. So I've made a few notes here that I'm just going to read out. Okay. So
yeah, fine.
What is a naturopathic colon hydrotherapist? Well, the definition of naturopathy is a system of complementary therapy. You can call it alternative if you like, based on the theory that diseases can be successfully treated or prevented without the use of drugs. The principles are do no harm, identify and treat the cause, treat the whole person, educate on the healing power of nature, and prevention. So naturopathic colon hydrotherapists are able to carry out colon hydrotherapy treatments, but they're also trained in offering dietary advice, supplement advice to support the colonic treatment, exercise, lifestyle advice, such as the importance of sleep and stress management, and also a variety of other complementary therapy treatments to bring about the healing of the individual. I mean, when I was in practice, well, even now, you know, as the founder of Just for Tummies, if someone contacts me and I feel as though they would be better served by seeing a different complementary therapist, and I will refer them to a nutritional therapist or a reflexologist or an aromatherapist or an acupuncturist, for example. And I'm sure they're all the same. So I just wanted to explain the difference, you know, what naturopathy and naturopathic means.
Yeah. Definitely. And I do the same, you know, if I know that there's somebody who they need to see another therapist of some kind, then you do, and you get your little network going of people you trust who you can send them to. You just want the best for your client, don't you?
Of course, you want the best outcome for your clients, yes. So what's the difference between the open system colonic equipment and the closed system equipment and the tank and gravity fed and machine? Because lots of people get confused about this. So the colon hydrotherapy equipment that you use and that I use was the closed system tank gravity fed. And I think, can we see that the tank behind you, Jane?
Yes.
In the top left hand corner, that's the tank, yes, and the couch is just below the tank, isn't? So
that's right.
That's where we've just explained the tubing and the speculum. Everything's closed, everything's contained. The open system is different. I kind of liken the closed system to being therapist led. a therapist-led colonic treatment, and the open system being client-led. And some people prefer that type of colonic. That's entirely up to them. Now, when it comes to the closed system, there are different types of equipment. So there's the tank, like you have there and like I use, but then there's the machine-led. But these are both closed systems, aren't they?
Yeah. Yes, they are. They are.
They're both closed systems.
Yeah. With the machine ones, they are like a box, most of them on the wall or stand by the wall with like a tube through the middle.
Yes.
But the therapist is actually in charge of how much pressure goes through and things like that.
That's right.
Where with this, it's all gravity, so it's very gentle.
Yes,
and that's what,
and of course you can increase the gravity, or you can slightly increase the pressure, sorry, if you want to. You know, if you're working on, say, a long, really lazy bowel, you'd increase it a little bit more, and of course you would cool the water down, wouldn't you?
Yes, that's right. That's
So
right.
can you just explain when you would cool the water down and when you would keep the water warm during a colonic treatment?
Yeah, when we cool it down is if sometimes when you've got a lazy bowel going on, so not much peristaltic action going on, we would cool the water down.
And you can see that peristalsis in the tubing, can't you, Jane?
Yeah,
because what I always said, you know, the outlet pipe, I always said to clients, just imagine this as being an extension of your bowel.
That's right. Yeah.
And we hold it, don't we? You know, during a colonic treatment, we hold it and we can feel the pulsations, can't we? The peristalsis, contraction, relaxation. So that's how we know if it's good if we're working with a lazy bowel or a fast bowel.
Yeah, you can see that. So yeah, and with a lazy one, we cool you down. And also if somebody's got a lot of what we call rabbit Todd kind of stool form coming out, little balls, you know, very slow, again, would cool you down. If you're Maltesers, that's right. But if it's the other way, if it's very loose, not fully formed, a lot of pressure in there, we'd keep you warm, we'd take you slightly warmer to relax the muscle down, and that would hopefully calm it down.
Yes. And you would always start a colonic with warm water, and you would always finish with warm water, wouldn't you?
Yeah. Oh, definitely. Never leave a colon cold.
Never leave a colon. Right, so I just want to finish this here. So an individual can choose whom they have treatment with, whether it's on an open system, a closed tank-led or machine-led equipment. The important point is that the therapist is competent, safe, and the client has a positive outcome.
Yeah.
So moving on to that, how does a person find a reputable colon hydrotherapist?
Right, well, I'm ARCH registered. ARCH is the Association of Registered Colon Hydrotherapists. We do have very high standards of prerequisites for training. So I know if I send any of my clients to another ARCH therapist, they're in safe hands. I think the base thing to remember is that anybody who's registered and regulated, but I mean, being ARCH, I'm quite. I will recommend anybody to ARCH.
I know you're very proud of your association, as am I, of course.
I am.
I'm still a member. Yes.
Yeah, I am. And I know how high they train. I'm currently doing a bit of teaching for them as well. So, you know, I'm sitting again through all the training with one of my students who's coming up. So I just know how much we have to know, how hard we work. I do recommend ARCH, and you'll be safe with any ARCH practitioner.
Yeah, absolutely. However, I have to say, Jane, that not everyone can access an ARCH registered colon hydrotherapist because, you know, depending on where they live. So I would say to people, look, first and foremost, Google who are the colon hydrotherapists in your area. Look at their website, read their reviews. Have they got Google reviews? Have they got testimonials on their website? Give them a ring, have a chat with them, get the measure of them, because it's quite personal
Yes.
experience, isn't it, having a colonic? And
Yeah,
you need to trust the therapist implicitly. It's very much a two-way relationship,
it
therapist
is.
and client, isn't it?
And the client's got to feel comfortable as well with the
Yes,
therapist.
but I think the therapist has got to feel comfortable with the client too. So, as you said, yeah, there are professional colonic associations like the Association of Registered Colon Hydrotherapists, and the other one. What's the other one? Where is it? The
RICTAT. I can't remember what the
yes, yeah. I did write it down somewhere. The Register of Integrative Colon Hydrotherapists and Trainers, or RICTAT for short. So when a person sees a therapist who is registered with a professional colonic association, then they know that they have public liability insurance.
Yes, yeah, definitely.
They know that their clinic is up to standard because there are clinic inspections. They know that the therapist has to comply with CPD requirements, continuing professional development, and my understanding is that's 30 hours a year. Is that still the case, Jane? So they have to carry out 30 hours a year continuing professional development. Have I left anything out?
No, I think that's it, and they're externally verified, regulated as well.
That's
so
right.
It's not just their professional association, but they've got an external association
regulator. Yes. So if anyone's struggling to find a colon hydrotherapist in their area, just message us and we will point you in the right direction. So I think have we covered this? What happens at a first colonic consultation? I think we've covered that, haven't we? I'm just going to so why is taking a thorough case history important prior to carrying out a colonic treatment? And for me, Jane, it would be red flags, medications and contraindications. So if you want to just explain that while I check some messages, all right? I'll be back.
Yeah, no problem. So it's really, really important that you get a consultation. We have to check. There are things that people with certain illnesses that we can't treat. So things like the inflammatory bowel diseases, if they're in an active state, any congenitive heart problems, very high blood pressure, so over 170, over 100. If they've got kidney problems, if they've got less than 50% function of the kidneys, because we're putting a lot of water into the system, they wouldn't be able to get rid of it properly. So there are important things like that could make you very ill if somebody hadn't done a consultation. Same with some medications as well. These change a little bit. So things like steroids is a big one, because long-term use of orally taken steroids can affect the integrity of your bowel wall, so it can make it very thin. So of course that's really dangerous for having chronics. And contraindications, which again to do with your red flags. And we just have to make sure really that you're just fit for treatment. The list is endless really. If there's
I know. My health questionnaire when I was in practice, Jane, was 7 pages long. But and I would also ask as well, I'd want to know their antibiotic history going right back to the childhood, and I'd want to know if they'd had any food poisoning events, that had caused diarrhea, because there's a big connection between both of those and an increased risk of developing IBS. So Facebook user, this is someone on Tummy Talk again. Right, I've learned so much from you, Linda, and have 2 colonics a year, and it's a brilliant treatment. Just the Tummy supplements are brilliant. Well, whoever you are, thank you so much for that. Right, so where are we now? So taking a thorough case history, yes, very important, because by taking a thorough case history, you can pick up on, you get clues as to why they're getting the symptoms that they are getting.
Yeah, definitely.
And it's like the antibiotics and the food poisoning.
Definitely. It's a bit like a jigsaw, really. We're pulling all the information in to see if we can find out where it's come from and get to the core of what's going on.
I call it dot to dot. I call it dot, you know, joining all the dots.
It is dot to dot. It is, you know, and very often you'll go back and say, when did all these symptoms begin? And they can say, oh, about 8 years ago. Did anything happen about that 8 years ago?
Yes. I ask people that all the time, Jane. You know, when people contact me through Just for Tummies, you know, I always ask, what's your antibiotic history? If obviously you can't remember when you were tiny, a baby or a toddler, but I want to know, you know, I want to know your mother's antibiotic history when she was carrying you. Did she have to have antibiotics when she was pregnant with you? Did she have to have antibiotics when she was breastfeeding? So I go way back. I certainly want to know if they've had food poisoning, which is a bacterial infection, or if they've had a virus like norovirus.
Or gastrovirus, anything like
I'd want to know if they're taking any PPIs, proton pump inhibitors, as well. And like you say, steroids. So you can really take a deep dive sometimes, can't you, into your clients or your customers' medical history. But, you know, you need to do that because the clues are there as to why they're struggling so much.
Definitely,
Oh, right. So back to colonics. How long does a colonic treatment take?
So first treatments usually take around about an hour and a half. Mainly because we do a good half an hour talk, going through your consultation, talking you through everything, showing you the equipment, and then about an hour for the treatment. The treatment probably itself is around about 35-45 minutes, and then we pop you on the toilet. I always say for at least a good 10 minutes, but as long as it takes. I never rush people with that part. So it works out around about an hour and a half. Any follow-ups after that are about an hour. So again, 35-45 minutes, 10 minutes on the toilet, a little chat before and after, catch up where you were and go through any tweaks to protocol or anything at the end.
I used to say to people, to clients as well, I say, look, if anything feels uncomfortable while you're having the treatment, just let me know. If you can feel pressure and you feel as though, you know, you need to go to the toilet, just let me know, because I can just whip the speculum out in 2 seconds and you can go to the toilet, you can empty on it, and then you can come back and you know, we can finish the colonic. And I know, Jane, when I've been to see you sometimes, you know, certainly when you kind of get mass peristalsis, you know, there's a lot coming out, and there's maybe, you know, too much for the tube to take. You know, it can feel a bit uncomfortable, and I hate anyone to be lying on the couch and feeling uncomfortable and feeling as though, you know, they've got no control over it. So like I say, you know, when I've been to see you, that's happened to me, hasn't it? And I've said to you, oh, Jane, can you just take the speck out and let me into the link
on the toilet? And it works well for people because, like you say, if there's a lot coming out and it can be uncomfortable, it's good to get them off. And then they can come back on and we can carry on, and it's more comfortable.
It feels so much more comfortable, and then you can get the rest of it out, can't you?
Yeah, definitely.
Right. So, oh yes, this is a good one, isn't it? How much water is used during a colonic?
Well, again, everybody's individual. Some people don't mind staying on the couch. Some people can only take a couple of tanks. So I would say probably between 50 litres up to maybe 100 at the most. 3 or 4 tanks worth of water. It depends. I mean, we don't want you on there for hours and hours because we don't want to affect electrolyte balance and things like that. But I would say average around about 80 to 100 litres per treatment. Only a tiny bit in there at any one time, though. We're not going to pump you full of 100.
Oh yes, of course. Because lots of people get a bit confused and mixed up between colon hydrotherapy treatment and a colonoscopy, you know. Completely different. A colonoscopy is a medical procedure. You have to go into hospital for it, and it's a camera, isn't it, that goes all the way around your bowel. And a colonic, you know, the colon hydrotherapist is just inserting that little bit you see that little bit of the speculum into the rectum, and introducing water under very low gravity.
And it's nice and warm filtered water as well, so nice and calming. It's nothing like a colonoscopy at all.
And you know, if you're an IBS sufferer and you're in spasm, you're having a really bad flare up, that warm water being introduced into the bowel, and then, you know, getting those trapped painful gases out, it's such a massive relief, isn't it?
Oh, it is definitely.
I'm just going to bring this up. Sorry, Jane.
All right.
I was really interested in this. Hi, Stephanie. Thanks for this. But alas, my internet is so slow. Okay. I can't follow this interesting conversation, and I wonder if this live will be posted again. Stephanie, just to say, I did say this at the beginning. This is being streamed on the Just for Tummies Facebook page, the Tummy Talk community page, YouTube, and LinkedIn under Just for Tummies. So it will be on all of those platforms to watch later. And I'll also be sending it out in a newsletter in the next week or two, and it will be on the Just for Tummies website under the blogs, health videos. If you're not sure, Stephanie, drop me an email. I'll send you the link. Sorry, Jane, where were we?
Oh. So just about the water, weren't we? How much water?
Yes. Oh yes, and I think we've covered this. The water temperature is sometimes adjusted during a colonic treatment. Yes, depending on what kind of bowel you're working on and what the symptoms are.
Yeah, and how it's reacting as well.
And how it's reacting, yes, yeah. So if you're working on a lazy bowel and you're putting warm water in, then you're not going to get very much activity. So you'd cool it down then, wouldn't you?
Yeah, definitely works really well.
Let's talk a little bit about herbs then, because many colon hydrotherapists, you know, including myself, I loved working with the herbs, absolutely love the herbs. So can you tell me what herbs you use? Perhaps you can show us some of the herbs. I can see the bottles there, Jane.
See the bottles? I'll get some clean ones out of the cupboard.
Tell us what's in the herbs, in the bottles, and when you would use those particular herbs.
So these are the ones I use. I mean, this is the IBLE formula that I use quite a lot of, because it's got your licorice and fennel in. So licorice is a really good natural laxative, gets everything moving. Fennel's brilliant for the trap gases. Got a bit of chamomile in there, so it just relaxes your bowel down. It's very gentle chamomile, and also some raspberry leaf and peppermint. So raspberry leaf is a good toner of the bowel. It will bring it, if you've got a bowel that's out of shape, it will bring it back into shape again. And peppermint again is really good for the gases. So it's a nice gentle tincture, that one.
I bet that smells gorgeous, doesn't it? I can just well, two of those herbs, the fennel and the licorice root, are two of the ingredients in my tummy tea, of course.
Oh, tummy tea, we love tummy tea, it's lovely. And then we've got the toning herbs. So this is for people who are quite constipated. So again, it's got your licorice and fennel. That's the two that are the base for most of our tinctures. You've also got some artichoke and dandelion root, so really good for your liver. So if you've got any toxicity from the stool being stuck in the colon and it being taken through, the dirty blood being taken through to the liver, the artichoke and dandelion root will support your liver function. I think that's it in that one. Yes,
just thinking, you've just reminded me actually, Jane. I'm just thinking about women who suffer with menopausal symptoms, because if the liver's not able to break down those hormones and excrete them, you know, it perpetuates their menopausal symptoms, doesn't it?
Yeah.
It can, you know. So colon hydrotherapy would be really good for women who suffer with menopausal symptoms.
Seeing a lot of menopausal ladies at the moment.
Do you? Oh, yeah. That's interesting.
Yeah, a lot of them. And I think a doctor came to speak to us at Arch a few years ago, and he was saying the last count of how many functions the liver did in the body was something like 518 different functions. So it just shows how important an organ it is to look after as well.
It's the warmest organ in the body, the liver is, because it's active all the time.
Yeah, yeah.
Mm.
And we need to look after it, you know,
Yes,
and
yes.
broken.
And of course, colon hydrotherapy, you know, the liver benefits from the secondary effects from colon hydrotherapy, because if you've got a toxic bowel, the liver's going to take the hit, isn't it?
Yeah, it is. And your liver can get very stressed, so it'll get to a certain stage and then just release dirty blood into the system, which can show up in your skin and all different problems.
Skin, mood, again, hormones.
Yeah, yeah. So it's a really good thing.
Yes, have I spelled that? I've spelled that incorrectly. That's sorry, folks. That's meant to be probiotic implant. You'd think I'd know how to spell probiotic. Right. What is a probiotic implant, and when is it used?
Right. Well, probiotic implants are really beneficial. What we can use after a colon has been had colon hydrotherapy. When everything is out, we've sat you on the toilet, everything's come out. What's going to come out, and what we can do is implant a good amount of bacteria back into the bowel, and we use a syringe and a catheter to feed it back in and implant a good high amount of friendly bacteria back into the bowel again. We generally use it when people have been on antibiotics and it's ravaged the good bacteria levels. It's really good for getting rid of the bad stuff, but it also gets rid of the good stuff as well.
And it's completely painless, isn't it, Jane?
Oh, it is. It's a little bit tickly when we pop it in, first of all, but you can't feel anything. And then we wrap you up nice and warm. I switch my lights off in here and put some nice gentle music on and leave you for 10 minutes and just let it settle back in the bowel again. So it's quite a good procedure if you've been on antibiotics.
I just wonder with people that suffer with proctitis as well, you know, which is kind of inflammation of the, you know, right at the end, the rectum, if they benefit from a probiotic implant. Right. So, what is a coffee enema and when is it used? And can you just explain that you don't use, you know, instant coffee? This is a special type of coffee.
Yeah, we use a proper enema coffee, and the blonder the roast of the coffee, the higher the active ingredient. So the palmitic acid, which is the item that goes through into the portal flow, gets into the bowel, into the liver, grabs on any toxins, flushes any poisons away. So it is a special enema coffee, and we generally use it. I mean, the most that we do use it is around about Christmas, after Christmas, January, when everybody's been overindulging, drinking too much. It's also useful for chemotherapy clients. We can use coffee enemas 2 days after a cycle of chemotherapy, and it does help settle the horrible bad reactions that you can get to chemotherapy as well.
Flush the chemo drugs out of the liver then?
It gets rid of the bad, the nasty toxins.
I kind of imagined that it would help with that.
Yeah. So we have to leave it at least 2 days after a chemo cycle, but then
but as would colon hydrotherapy as well after chemotherapy.
Oh yeah, definitely.
Right, so yes, many people get confused between an enema and a colon hydrotherapy treatment. What are the major differences?
Yeah, well, it gets me quite mad sometimes, especially these nurses where, I do your job at hospital and you don't, you do an enema.
Yes, completely different.
It is, but they don't understand it. So an enema really just clears the first bit of the bowel. I think a high enema can supposedly get up to the splenic flexure, which is the first corner on the left hand side. With a colon hydrotherapy treatment, what we're aiming to do is get right the way round, right down to the cecum, which is the last part of the bowel. So it's completely different. The enema is good for clearing the rectum. A colon hydrotherapy can cleanse the whole of the system,
the whole length of the large bowel. And with an enema, you know, we're only talking about what, 500 mils of maybe a litre of water that you can introduce, and you just insert a very thin tip into your rectum. Turn a little tap on the tube, the water goes in, you try and retain it for as long as you can before you go to the toilet to empty. But as you say, it only clears out the bottom section of the bowel, the rectum, unless you can kind of, do some kind of yoga shoulder stand and, to try and get the water a bit further up there. But nothing like a colon hydrotherapy treatment.
No, we don't ask you to retain anything or hold it in. Everything is, you just relax and we do it all for you.
Yeah, that's right. That's right. So, what's a typical client then, Jane? Male, female, age, and the most common symptoms that they present with?
I would say the female male ratio is 90% female, 10% male. Wasn't my last records when I were having a look. Age range, we see quite a large age range from late teens up to, I've got a lady coming next week and who's 87 for her first colonic.
Wow, that's amazing.
So we've got a really wide age range. Most common symptoms, bloating definitely, and I'd say constipation and IBS. They're the three main ones, I think. Yes.
So this 87-year-old lady then, Jane, what are her symptoms? What's made her approach you for colon hydrotherapy?
Well, her bowels aren't emptying as well as they used to, and I think it's an age thing. As we get older, things slow down, don't they?
Things slow down, things prolapse as well, don't they?
Exactly. So she's just got fed up with feeling all full and the subsequent bloating that goes with it, and wants to come and give it a try. So I can't wait.
Good for her. I think that's absolutely amazing. I think my oldest client when I was practicing colon hydrotherapy was 83.
Wow. I had an 83-year-old ex-midwife in the other week, and she was wonderful, and she nearly bounded out here. She couldn't believe how much was in there. She had the mirror up so she could see what was coming out.
Of course, we've not mentioned that, have we, Jane? People can, if they want to, when they're having a colonic treatment, they can. You kind of position a mirror at the end of the couch so people can actually see what's coming out of them.
That's it. And she couldn't believe it, how much she said. I never knew there was that much in there. So she was enthralled with it.
But when you think about it, I mean, I'll ask you for these examples in a minute, but I'm going to give an example of my own. I remember, many years ago now, a lady came to me for colon hydrotherapy, and she'd been suffering with constipation. So she'd not had a proper full volume bowel movement for around 3 weeks, just little bits and bobs of rabbit tods. And she walked into my treatment room, and she looked 9 months pregnant. She was so bloated, she was so uncomfortable. A sister had been to see me for colon hydrotherapy, which is why, she felt comfortable coming to see me. Anyway, she weighed herself. I got some scales in the clinic, and she weighed herself before she had the colonic, and then she weighed herself afterwards, and she lost 7 pounds during one colon hydrotherapy treatment. And I'm sure you can cite examples just the same, Jane, as can many other colon hydrotherapists.
Definitely.
You couldn't believe the amount of solid waste that was sitting in her back. But then when you think about it, if you're eating 3 meals a day, where do people think all that waste, food is ending up if they're not evacuating it?
Yes, that's it. It's amazing how much is in there. I mean, it's 5 foot long. It can hold a lot, and it's very muscular.
And it expands, doesn't it?
Elastic, so it can hold so much, but
can you give us a couple of examples of the amazing results you've achieved for your clients, particularly those that have been to see you with IBS symptoms? I mean, I'm sure you've got lots and lots, Jane.
Quite a few. I mean, IBS wise, we'll have quite a few, and some people can get really upset because I can have them in tears in here, you know, because they don't know what to do with themselves. They've got nobody to talk to. They've not been able to talk to anybody about it before. And I had one lady, she'd been coming to me about 4 years now, but she came and she wasn't going to the toilet for weeks on end. Again, like you said, she was so solid with gas as well. And she just didn't know what to do with herself. You know, she was constant tears. First treatment got a fair amount out, but we like you to maybe have 2 quite close together if possible. And she came back for the second one, and we've got her on to 6 monthly now, and she never looks back. She said, I can't believe how I was when I first came. And the
had she had IBS for quite a long time then?
Yes,
what IBS-C, where constipation is predominant?
Constipation. And the doctors had got her on no end of laxatives. I think they got her on the PPIs as well, because she was getting acid reflux. But it would
from all the pressure, the upwards pressure. That's so common.
Exactly.
Well, I hope she told a GP, you know, how amazing the colon hydrotherapy treatments have been for her.
They are coming round a little bit now, the doctors, I must admit. You know, we are getting a few of them saying, well, you can try colon hydrotherapy, which is good, which is useful. But yeah, I've had quite a few like that over the years, and she just comes twice a year now just for maintenance. She says, I can't believe how I was when I first came and the difference to how I am now. You know, she's gardening, she's got an allotment, she's on a bike.
Life-changing, Jane, life-changing, the treatment.
Oh, it is, definitely.
I happened to go on your website recently, and you've got some amazing Google reviews, Jane. How many have you got?
Oh, I think we're up to about 87, 88 now.
I read a few of them. They're absolutely fantastic. Well done, Jane. So proud of you.
Thank you.
Right, so we've covered this, but I just want to go in a bit deeper as to how a colonic can reduce IBS symptoms. So your lady then that presented with IBS-C, where constipation is predominant, I used to explain to people, this is what happens during a colonic with constipation. We introduce the water very gently into the bowel. And we do that, especially when the bowel is quite impacted with hard.
Oh, definitely. Yeah.
And then what happens? The water, it acts as like a solvent, doesn't it? It begins to soften that hardened feces, and then peristalsis can just push it out.
That's right. Yeah.
Would you agree?
Yeah, we do. But yeah, I think gently, like you say, is the aim for it to start with, because they can't take a lot of water. There's that much
a conservative treatment initially.
Yeah, very gentle. You know, you hear these horrific kind of being filled up to as much as they can take and things like that. And it's not
bad technique. Bad technique.
Yeah,
that is. Yeah.
Well,
and with
sorry.
Go on.
Sorry, you carry on.
Say, with IBS, IBS-D, where diarrhea is predominant, I still encourage people to have colon hydrotherapy, even with IBS-D, you know, just to help calm it down. And certainly, if someone's got diarrhea because they've had food poisoning, I definitely encourage them to have colon hydrotherapy to help wash out the parasite or bug.
Definitely. And we've got a good herbal disinfectant mix as well, haven't we? I know you used to use Linda.
Oh, I use gallons of it.
Me too.
Sorry, that's old money, isn't it? Litres of it. Litres and litres.
Litres of it. But if anybody's had any bugs or, like you say, any food poisoning, I usually try and put one through every few months anyway, or few visits. But we'll use the herbal disinfectant just to get rid of anything that might be lurking in there. You never know. And it's all good stuff.
I just want to say, because you mentioned acid reflux, and I get contacted by on a daily basis, people who suffer with acid reflux. And so I ask these questions. Okay, do you suffer with bloating? Have you got a hiatus hernia? If you suffer with bloating, is the bloating worse after food? Is the acid reflux worse after food? Is the hernia worse after food? Because there's such a big connection between acid reflux and what's happening further down in the gut.
Yeah.
Especially if there's lots of gases, bloating, pressure building up and pushing up into the diaphragm and up into the stomach and causing regurgitation of acid-drenched food into the esophagus.
That's right.
And I know, being an ex-colon hydrotherapist, and I'm sure you'll agree with me, Jane, that when you have someone come to you for colon hydrotherapy treatment, they've probably not come to you with acid reflux. They probably come to you because they're bloated and gassy and constipated.
That's
but
right.
when they've had the colonic treatment, their acid reflux improves.
It does, definitely. And I
that
always
pressure,
say to
that
them,
pressure is
that's it. And I always say to them, you just think how many organs you've got crammed into quite a small space. Slight distension in the bowel can press up on your stomach, your diaphragm, down on your bladder. It can cause no end of problems. So once you've
pressing on the bladder and causing irritable bladder.
Yeah, definitely. And it's so much in there. There's 21 foot of small intestine in there, 5 foot large intestine. So, the slightest bit of distension in there can push them and cause havoc, really. So the more that we can keep it in shape and the 2-inch diameter it should be, the better it will be.
Yes. I just want to mention a bit about UTIs as well, urinary tract infections, because, there's a connection between UTIs and constipation. So if a woman is constipated a lot of the time, all that hardened feces is building up in her bowel, then it can push into the bladder. If it pushes into the bladder, it can prevent the bladder from emptying properly.
That's right.
And the longer E. coli bacteria is sitting in the bladder, the more, that opportunistic bacteria, the more likely it is to cause an infection in the bladder.
Yeah.
So any woman who suffers with recurring UTIs and constipation, they absolutely need to get that constipation sorted out.
Definitely. Goes hand in hand, really, doesn't it?
Right, let's have a look at contraindications, because not everyone can have colon hydrotherapy, can they, Jane?
They can't. Not everybody. We've got quite a big list, actually. I was just going to try.
I've got the list here as well.
Have you?
So we've got these industry agreed contraindications. We've got the absolute contraindications, and these are people you would just not give colon hydrotherapy to. And then you've got the relative contraindications, where they're industry agreed as well, and the suitability of the treatment remains specific to the individual and must be assessed by a professional colon hydrotherapist.
That's
right. So do you want to go through a few of the absolute contraindications?
Yeah.
So these are people who, unfortunately, just cannot have colon hydrotherapy.
No.
Even if they, I'm just going to say a caveat, even if their GP gave them a letter saying that they could have colon hydrotherapy, I don't think any colon hydrotherapy should go anywhere near anyone that presented with these symptoms.
No, definitely not. So we've got quite a big list. We've got severe heart disease, which is uncontrolled. Severe hypertension, which also is uncontrolled. Any diuretic therapy, renal insufficiency, using dialysis, that kind of thing. Severe hemorrhoids or very badly inflamed. So obviously it will be very painful for us to insert the speculum. So that is out of the way.
I did have a lady contact me today, Jane. She emailed me today and she says, is it possible to have a colonic if I've got a grade 1 hemorrhoid? So a grade 1 hemorrhoid, it's an internal hemorrhoid. It's not prolapsed, it's not hanging out, it's not infected. So to me, that would be a relative contraindication. You get that lady into your clinic, you would have a chat with her, take a history, you do the digital examination, and then you would decide whether or not she was suitable to have colon hydrotherapy.
And the digital is
anyone with large prolapsed infected hemorrhoids, well, they wouldn't be coming to your clinic anyway.
No,
they wouldn't want you anywhere near them with a speculum.
No, definitely not. But a grade 1 should be fine. You know, if you do your digital and she can accept it, you know, there's no pain there for her, you should be fine to have the treatment.
Especially if the hemorrhoid has been caused by constipation, Jane. You know, absolutely, she needs colon hydrotherapy.
Definitely. So what else have we got? We've got any active inflammatory bowel disease, including diverticulitis, colitis, or Crohn's, etc. Severe liver disease, so cirrhosis. Any recent colon surgery or rectal surgery. We have to leave that at least 6 months before we can actually touch them. Any recent laparoscopy. So we have to leave that 6 weeks at least. Or any recent radiotherapy of the abdominal area affecting the bowel. What else have we got? Rectal bleeding or severe hemorrhaging, any fistulas, and pregnant ladies. We can't touch pregnant ladies.
No.
And children under 16. Now, that's without a GP or medical specialist written referral. But to be quite honest, I don't think I would treat anybody under 16.
You wouldn't want the responsibility, would you, Jane?
No.
I've also got down here under absolute contraindications, abdominal hernias.
Yes.
Cancer of the colon.
We can treat abdominal hernias as long as we can reduce them.
Yes.
If they're unreducible, then we can't touch them, but we can treat them if we feel that we have got the knowledge to actually do that as well.
Yes.
You know.
Okay, so the relative contraindications then. Diverticulosis is on this list, Jane, and it does say that they can have colon hydrotherapy within 3 months of an episode of diverticulitis. So for those people that don't know what diverticulosis and diverticulitis is, it's a common, relatively benign disease of the large bowel. Well, it can affect any length of the gastrointestinal tract, but it tends to affect the large bowel, in particular the left side, the sigmoid, rectal portions of the bowel. And these you get sort of pockets, don't you?
That's right.
Pockets in the bowel. Very common for people over the age of 60, although we are seeing more young people presenting with diverticular disease, people in the 30s and 40s. That's got to be down to diet and lifestyle. And of course, diverticulitis, anything with itis on the end, means inflammation. It's where those pockets become inflamed. And that usually means antibiotics, doesn't it?
It does definitely. So we can't treat anybody within a 3 months flare up stage.
I've just marked it with my marker pen, June, because I thought it was 6 months, but it's 3 months, is it?
3 months. Yeah, they've looked at the industry standards and readjusted a few little bits.
Because I'm sure it used to be 6 months.
Yeah, I think it used to be quite a while, didn't it, Linda, at one time?
We've also got, you wouldn't want to give colon hydrotherapy to a highly anxious, stressed, or emotional person, would you?
No, definitely not.
And they probably wouldn't come to see you for a colonic if they were, very anxious. You don't want them having a panic attack on your couch.
Oh gosh, no.
Get the rest of you everything out.
No, we don't want none of that.
Yes, you've already mentioned about long-term oral and rectal steroids, haven't you?
Yes, that's a big one.
And then, of course, we've got eating disorders, severe underweight or eating disorders.
Yes,
because some individuals would use colon hydrotherapy as a means of losing weight, wouldn't they?
That's it. I mean, if they've said if we do have any clients come along with the eating disorders, we have to work with their team that's backing them up. So we have to know the full picture of what's going on.
Right. Just want to, Facebook user. Hi, is probably somebody on Tummy Talk. I've been having colonics for years as I feel it's vitally important for my health, as bowel problems run in my family too. There's absolutely nothing to it, and I'm a total advocate for the treatment. Thanks for all you do, ladies. Well, thank you so much, whoever you are, for that comment, and I absolutely agree with you 100%. There's a question here. Why does the removal of your gallbladder cause so many problems? And I think that that might be a video for another date, because gallbladder can cause problems. One of the symptoms is diarrhea. Many people who have had their gallbladder removed can be misdiagnosed as having IBS-D, when in actual fact they've got bile acid malabsorption. And it's a special test that they need to have to determine if they have that. Right, so, I think we've covered this. I have a fissure. Can I have a colonic? No.
Not while it's open, no. Once it's healed and healed for a good time, then maybe we can look at you. But if it's an open fissure, and again, it's too sore when you do these speculum insertion.
Can you imagine, Jane? Yeah. I think fissures that don't resolve, it's surgery, isn't it? To remove the fissure.
Put a stitch in there, don't they? A seat and stitch. I think they put in to try and close it together.
Yes. I had a lady contact me, and she had Botox for her fissure.
Oh, okay.
Yes, and but unfortunately, she developed headaches at the same time as having the Botox for the fissure. I mean, we can't say for sure that the Botox caused the headaches, but it was a bit of a coincidence that she never had headaches before, and they started when she had the Botox for the fissure.
Oh, dear.
So this one comes up a lot, doesn't it, Jane?
Yeah, it's unfortunately we can't treat pregnant ladies in any trimester. I think years ago they used to let them be treated after the first trimester, didn't they? But
I remember when I first trained in colon hydrotherapy, then yes, but I never would even then.
No,
I'm not having that responsibility.
No, it's not worth taking the chance, is it? So what I usually do is refer them back to the GP, really, to help, because they're the only ones. We don't want to give them anything, and like you say, you'd have it on your own conscience if anything happened. I couldn't live with that.
If a woman contacts me and she's suffering with constipation and she's pregnant, then I kind of do a little bit of detective work. Has she just suffered with constipation since she's been pregnant, or has she had it a while? And I just recommend some probiotics, like live bacteria, maybe some digestive enzymes. Tell her to increase a fatty fish, an oily fish, and a water. Give some dietary advice as well. But certainly refer her back to her
or a midwife, even.
Midwife, Right. So, so back to diverticular disease. Can I have a colonic? So yes, they can. They can have a colonic if they've been diagnosed with diverticular disease. Do you, if you're treating someone with diverticular disease, do you take any particular measures, to ensure that I'm just thinking of, from a safety aspect, really, Jane. I mean, so for example, would you keep the pressure very low? The pressure of the colon very low. You wouldn't go for long, hard films, for example.
No, definitely not. No. I mean, I don't generally treat like that anyway, to be quite honest. But definitely, if they've had a diverticulosis within, like you say, after the 3-month period, I'd still go very gently with it. But they can.
I think diverticular disease, and in particular diverticulitis, is very poorly managed in primary and secondary care. I'm contacted by people who suffer with diverticulitis, and they have to get to the stage where they've got an infection, an active infection, diverticulitis, before anything is done about it, and they don't understand, how they can help reduce the diverticulitis attacks, you know, through dietary management and proper bowel hygiene as well. Certainly
Yeah.
avoiding getting constipated, you know,
Oh,
getting
yeah.
some probiotics, taking some digestive enzymes, you
That's
know,
it.
fish oils as well. If they're not eating plenty of fatty fish, take an omega-3 supplement. I mean, I've
And
written a
things.
diverticular fact sheet. It's on the Just for Tummies website.
Okay. And I've heard fenugreek seed is very good for taking the bowel mucosa.
Yes.
So it helps that.
Another
So
one of the ingredients in my tummy tea.
is fenugreek. Brilliant.
Right, so someone asked this question today. Does this treatment help with gastritis and NAFLD, non-alcoholic fatty liver disease? Well, if you are going to see a naturopathic colon hydrotherapist, then they may decide not to give you a colonic. They probably would. I mean, anyone that came to my clinic got a colonic, to be honest with you. I'm so passionate about it. But, you know, you would be able to give them other advice, wouldn't you?
Oh, yeah,
Diet,
definitely.
supplements, that kind of thing.
And again, it'll be the whole picture again. It will be from the consultation.
Yeah,
You know.
holistic and holistic. Yes.
Yeah.
So,
Definitely.
does this treatment clean out the whole bowel? Well, it depends what they mean by the whole bowel, doesn't it?
Yeah. I mean,
Because we've got the small bowel and we've got the large bowel.
yeah. If the large bowel, we try to get right way round. That's what the aim is, to get water into the cecum. So yes, if it's the large intestine that they're talking about, then that's, yes, we can do.
That is the aim, yes. May not necessarily achieve that in the first treatment, just
Oh, no.
depends what the symptoms are. It depends how they feel on the couch, how comfortable they
Yeah,
are. But
definitely.
that is the aim eventually.
That's it. And like you say, if somebody's been struggling for 20 years, we're not going to get it all out in one go and get them right.
No, exactly.
It's going to take some time.
Exactly. So yeah, so how often is the treatment recommended?
Again, it depends. We don't blanket ban everybody. Each person is an individual. Some people, I personally have mine every 3 months because my bowel is very lazy. I've got some people I just see once or twice a year. So it all depends what we see during that treatment. And part of our code of ethics is not telling you that you need more than what you actually need.
Yeah.
And I know that none of my colleagues would do that. So we give you our honest opinion on, you know, how often we think that you can do. And we keep an eye on you. And as your bowel improves and gets better, we will wean you out. So, you know, once or twice a year is the ideal. But somebody
again, being naturopathic and coming at it from a naturopathic viewpoint, Jane, you know, you're giving them advice on diet, on lifestyle, on supplements that may help as well.
Yeah, oh, definitely. And it's like a 50-50 split on what I can do my side and what the client can do their side. So they go home and eat well and exercise and sleep and look after themselves for me to do it in the clinic.
Yes,
So
like I say, it's very much this two-way relationship, isn't it? Of mutual trust and understanding, yes. So yes, someone asked this, and we've covered it, can I have this treatment if I have inflammatory bowel disease like Crohn's or colitis? Unfortunately, no. But again, Jane, that's if they have active disease. What about if it's in remission, Crohn's and colitis?
If remission, I mean, it's again, everybody's different. There has been some input from some of our lecturers that are saying that they're better handled with dietary advice.
Yeah.
I have got clients who have had colitis in the past, who come now and again. So again, it all depends on how bad it is. I know they're in remission. Dietary values really have a lot to for as well.
And I recommend supplements, probiotics, essential fatty acids from omegas. But one of the symptoms of colitis, it can be constipation, can't it?
Yeah, it can be, can't it? But I think you have to take each case as an individual.
Absolutely, yes. You need to take the you need to take the medical history, don't you? And then make a decision. Yes.
Yeah. And things like Elm are really good for
inflammatory
diseases.
Yes. So this one, I have celiac disease. Can I have this treatment?
Mm-hmm.
That's a thumbs up, isn't it?
Definitely. Yeah. I mean, again, providing it's not in a really bad state and flaring up, because obviously they wouldn't want to put themselves through it if it was in a bad state. But I've got a lot of celiac clients come, and it really does help calm it
So
down.
celiac disease, it's an autoimmune disease, isn't it? And it's
Yeah.
where anyone who ingests gluten, the immune system just goes crazy, and it attacks the lining of the bowel, and it can cause leaky gut and
Very
pain and
yeah.
problems with absorbing nutrients, of course.
Yeah, it's very nasty, it is.
Right, this one crops up a lot, doesn't it?
Oh, yes. Yes, it does.
Do you want to take it?
I mean, no. The way I look at it is that if we washed away all the healthy bacteria every time you had a bowel movement, it'd empty your bowel and it'd wash it away anyway. But what we know is that the good and helpful bacteria actually implant into the bowel walls. So when we're treating, we can't wash that away, and a good diet after it, plenty of vegetables to give it something good, probiotics to get that bacteria
Probiotics, prebiotics,
yeah, and it will recolonize within, I think it said 8 hours, something like that.
Yes.
Stuff is in the bowel walls.
Yes, because like you say, there's healthy and unhealthy bacteria floating around in the large bowel all the time. And when you have a poo, you're going to be pooing some healthy and unhealthy bacteria out. So the same is going to happen when you have colon hydrotherapy treatment. But as you say, the healthy bacteria, the nuclei of the bacteria is deeply embedded within the biofilm that lines the bowel wall.
In the bowel, yeah.
If somebody's having a colonic every week, then yes, maybe eventually that biofilm would be degraded, and but you wouldn't see anyone.
It would take quite a lot, I think. We were talking about this at the weekend with Roger Grews, who you know, and there was an actual paper that came out with the Vietnam soldiers, and they did a lot of colonics over an amount of time, and there was very little difference in the bacteria levels. There was hardly anything.
Oh, interesting. Yeah.
So it was really interesting. But the Vietnam soldiers did this in the 60s, I think it was.
Okay.
They did all this research, so it's quite interesting. But no bad effect with it at all.
Let's see if we've got any more questions. Facebook user again. Hi, wherever you are on Tummy Talk. Great to see you both. Hope you're both well. Yeah, we're fantastic, aren't we, Jane?
We are.
Another Facebook user. I'm spreading the word. Thank you so much. Oh, right. And going abroad can cause problems too. I don't know if you mean like picking up a bug, like food poisoning or something when you're going abroad, but yes, that can happen. And that's why I always recommend anyone that's going to the Far East, India, Africa, South America, the Caribbean, that they take some of our charcoal capsules and make citricidal as well. Have you come across citricidal, Jane?
Yeah, citricidal. I can never remember
grapefruit seed extract, isn't it?
I always say that, but I can never remember citricidal. But I always tell everybody. I had a lady who was a teacher in Thailand, and she was vegan, and she came back here, and she had a roundworm in her small intestine and something called defragilis, an amoebic in her large intestine, and the doctors couldn't get rid of the defragilis. And they found out that it's caused because they use human excrement in Thailand as manure. And she was vegan, so she was eating all of the vegetables. She was washing it, but obviously not. She needed the citricidal to get everything off it, to wash her vegetables in. And she came back and nasty. So
I'm sure I read somewhere that they are, or they're going to use human excrement. Our farmers are.
Oh no,
Have you read anything like that?
no, I haven't seen that. Hope not.
I don't think I dreamt it. I'm sure I read it somewhere.
Yeah.
Um,
Don't like the sound of that, Linda.
don't like the idea of that. Oh, hi, Jill.
Hi, Jill.
Lovely. Thank you for joining us, Jill. Right. Any more? Let's have a look. Oh, I've just made an appointment in Stokesley for one, Linda, as recommended by you. So fingers crossed. So whoever you are, Facebook user, bet you're on Tummy Talk, let us know how you got on. We'd love
Yeah.
it.
Exciting.
And then someone else, I'm not far from Stokesley, and I'm wondering who you found. Oh, well, I'll let you two sort that out. Oh, is it Amanda? Is it Amanda Cutler in Stokesley? Is that up north somewhere?
Yes.
Amanda, I've recommended you today and sent your website link to a couple of people.
She's up Middlesbrough way, isn't she, Amanda?
It is, yeah. She's Geordie, Amanda. She's a Geordie, isn't she? Right.
You'll be all right with Amanda. She's lovely.
Oh, she's very experienced. Yeah, very experienced. So I think that's it. Unless you want to add anything else, Jane.
No, I don't think so. I think the main thing is try not to be frightened of the procedure. We do tend to frighten people with what we're doing. You'll find that any colon hydrotherapist will be here to look after you, and you know we're quite caring people in this trade. We have to be anyway. But
well, yes, because sorry, Jane, but the majority of us know we know what it feels like to suffer with IBS or to be constipated or to be crampy, and that's why we decided to train in colon hydrotherapy, because we'd had it ourselves, and you know we'd experienced these amazing results. So we wanted to train and offer it to other people.
Definitely. But don't be afraid. Take that first step, or give us a call and have a chat with us. You know, hopefully it'll put your mind at rest, and you know, come and give it a try, because it works really, really efficiently and it's brilliant. I wouldn't be without.
And go on Getting Colonics and read Jane's fantastic Google reviews, and go on Just for Tummies and read our fantastic Google reviews as well.
Yeah, they are very good.
Jane, I can't thank you enough, because I know how busy you are. Are you still working 6 days a week in the clinic?
Yes, quite busy at the minute.
Oh, you're mad. You're mad. But of course, you've got Sarah now, haven't you?
I have. She's lurking in the background here.
Shit. Tell her to come and say hi.
Come and show your face. She's just finished, so she's got her.
Hello, Sarah. Sarah, do you want to tell us a little bit about you and why you? No. Okay, Jane can tell us then.
She's shy. She's shy. Well, Sarah's come out of the NHS after 34 years, so she's come to work with me.
Yeah, I've heard great things about Sarah. People have been messaging me. Yeah,
everybody loves her who comes to see her. So
yeah, and it's important to have that, you know, that bedside manner, isn't it? People need to feel comfortable. They need to feel that they're in a safe environment. Yeah.
Oh, definitely.
Well, Jane, I'm going to let you go on, because I bet you're dying for a cup of tea, aren't you? You're dying for a cup of tea.
I'm ready.
All right, thank you so much, Jane. Thank you so much. So like I say, this has all been streamed across the channels, and we'll share it in a newsletter as well. And you're welcome to, you know, stream it on your channels, Jane, of course. And thank you everyone for watching. And I really hope that we've answered some of your questions. If you've got any more questions, anything that we haven't answered, just post below this video or send us an email. Okay then, Jane, bless you.
Thanks,
Love you. Thank you, Jane. Bye-bye.